The organ trade, a global black market. The United States Congress passed the National Organ Transplant Act in 1984 to address the nation's critical organ donation shortage. This made the sale of human organs illegal. Subsequently, throughout most of the world, the sale of human organs became outlawed also. Today, however, there is a global black market for organs that touches dozens of countries and generates many millions of dollars. But at whose cost? The poor man who sells his kidney to put food on the table, or the wealthy that pays cash for a kidney so he can live? There are simply not enough human organs to go around. Over the past 25 years, as medical advancements have increased, the global demand for transplant operations has skyrocketed, while the supply of legally available organs has remained the same. The illegal trade in organs has emerged to fill this ever-increasing gap. Transplant clinics, international organ brokers, corrupt medical and government officials have established a lucrative business selling human organs illegally obtained from live donors. Elizabeth Shivers of Brown University writes, "There are strong regional trends within the global trade in human organs. Most recipients from Asian nations receive organs and transplants in China. Wealthy foreigners travel to South America to meet their needs. Brazil dominates the trade in human organs in South America. Turkey and India serve as the primary markets in the Middle East." Transplant tourism is the name for this organ trading network. Recipients are treated to resort-like settings, unlike an ordinary hospital, and return to their physicians for follow-up care, vague as to the origins of their newly transplanted organs without questions asked. Many indigent people living in developing poverty-stricken countries use the organ trade as an opportunity to make money to support a family. Usually uneducated, they do not grasp the concept of what selling an organ can do to their health. Paid kidney donors do not receive follow-up care, and they are also associated with depression, regret, and discrimination, says World Health Organization, known as WHO. WHO provides a table with information regarding the organ donors of 3 nations above. Newsweek magazine claims not all organs flow from poor countries to rich ones. Americans, for example, are both buyers and sellers in this global market. A woman in Kentucky contacted a person posing as an organ broker. She wanted to sell her kidney or part of her liver to cover the costs of badly needed dentures. A man in Brooklyn purchased his kidney from an Israeli man who wanted to visit America. Tom Diffel, a transplant surgeon at New York University's Langone Medical Center, points out that there are a couple places around that have reputations for doing transplant with paid donors, and some hospitals have a don't ask, don't tell policy. Many wonder why the sale of organs is not made legal. The answer is clear: the ethics of equality for all. Dr. Jeffrey Kahn, director of the Center for Bioethics, states it is exploitation when one person takes advantage of the misfortunes of another for his or her own benefit. Also, the sale of organs gives an advantage to those with the means to pay for them. Santa Clara University Center for Applied Ethics writes, "Societies should not adopt any practices that would create injustices or would violate the rights of individuals. Allowing organs to be bought and sold will do both." If a market in organs were to develop, ability to pay would determine who could buy organs, while economic needs would determine who would be motivated to sell their organs. The very wealthy would end up buyers of the organs being sold by the very poor. Such an unequal distribution of health benefits and burdens would be unjust, and such a scheme would encourage the most vulnerable in society to treat themselves as a commodity and allow others to violate their rights for commercial gain. There are things you can do to help. Not only be an organ donor on your driver's license, but also making out a living will indicating your wants to be a donor. When untimely death occurs, family members may not know you want to help others to live.